Recovered COVID-19 patients have a lot of stories about what the virus did to their health in the weeks and months after they beat coronavirus.
Yeah, we hear such varying accounts. Doctors are trying to wrap their heads around this as well. 41 Action News reporter Jordan Betts asked one doctor what recovered patients should do and what they really need to keep their eyes on when it comes to their health.
When it comes to COVID-19, there are so many unknowns. Zoe Jones would know. She got the virus early on in the pandemic.
Unfortunately, I had like every symptom in the book. I had the worst ones were the headache. There was a consistent headache for like 3 weeks.
For Jones, some of the symptoms lingered on for weeks.
The chest pain was really hard. I'd like get up and go work out or something, and immediately after I had to like recollect myself.
That poses the question, should people like Jones get a checkup?
A lot depends on the amount of residual symptoms somebody has and if they're in a high-risk group. So if somebody is low-risk group, not advanced stage or medical comorbidities, and feeling really well without concerns, we always encourage preventative care.
Kind of tell me, what signs should we be looking for after isolation that would make someone want or need to see a doctor?
Either traditional blood clots in the legs, so swelling that's asymmetrical, one leg is dramatically larger than the other, painful red. If somebody had significant chest pain or any of those, regardless at what point of the illness they're in, it would warrant seeking care right away.
Doctors say heart issues is another one people should be aware of.
Kind of in its own category, but part of the circulatory system would be cardiac issues. And so there does seem to be an increased rate of heart attacks, but also cardiomyopathies where inflammation of the heart occurs. So typically looking for signs or symptoms of ineffective heart function.
If something is concerning you, see a doctor. Dr. Breichel says he tells his patients who've recovered from the virus to always wear a mask and to stay 6 feet apart. Jones says you can't let your guard down.
Just remember how bad it felt when you had it and how terrible it would be to give it to other people. That's one of the worst feelings.
Jordan Betts, 41 Action News.